Hi there, this is Nursing Education Videos. Today I will be going over the Crohn's disease versus ulcerative colitis NCLEX Nursing Questions Quiz on registerednursern.com. I will be reading the review notes and doing the quiz at the same time. I hope this information is helpful for your learning. All credit for this information that I am reading goes to Sarah at registerednursern.com. Again, all credit for the information that I'm reading goes to Sarah at registerednursern.com. Please refer to the websites in the description box for all credit and information. Links for the information will be included in the description box. So this is a quiz that contains NCLEX review questions for Crohn's disease versus ulcerative colitis. As a nurse providing care to a patient with Crohn's disease and ulcerative colitis, it is important to know the classic signs and symptoms, complications, and medications used to treat the conditions. In the previous NCLEX review series, Sarah had explained about other GI disorders you may be asked about on the NCLEX exam, so gastrointestinal disorders. So be sure to check out those reviews and quizzes as well. Crohn's disease versus ulcerative colitis. This quiz will test your knowledge on Crohn's disease versus ulcerative colitis in preparation for the NCLEX exam. Question number 1. True or false? Crohn's disease and ulcerative colitis are two forms of IBS, which is irritable bowel syndrome. So, according to the notes here, both are a form of inflammatory bowel disease, so IBD, not IBS. So it would be false. They are two forms of IBD, inflammatory bowel disease. Question number 2. Select all the options below that are similarities between ulcerative colitis and Crohn's disease. A, each causes inflammation. B, both affect the serosa layer. C, each are found from the mouth to anus. D, they both increase colon cancer risk. E, the cause of both is unknown. F, the cure for both diseases includes total colectomy. So under the similarities, the cause is unknown. That may be due to a faulty immune system in overdrive that causes the gut to become inflamed. Causes inflammation and ulcer formation. Both increases colon cancer risk. So question number 2, it's to select all the options below that are similarities. It would be A, each cause inflammation, D, they both increase colon cancer risk, and E, the cause of both is unknown. Question number 3, which medications are used in the treatment of Crohn's disease and ulcerative colitis? Select all that apply. A, guanylate cyclase -C agonists. B, anticholinergics. C, 5-aminosalicylates. D, antacids. E, corticosteroids. Or F, immune suppressors. So select all that apply. So 5-aminosalicylates, corticosteroids, E, immune suppressors, Okay. Question number 4. Blank is most commonly found in the terminal ileum and beginning of the colon. So blank is most commonly found in the terminal ileum and beginning of the colon. Is it ulcerative colitis or Crohn's disease? So if we look at the notes here, Crohn's disease affects the whole GI tract, from the mouth to the anus to the small/large intestine. Ulcerative colitis affects only the large intestine, very rarely the small intestine involved. So Crohn's disease is most common in the terminal ileum and the start of the colon. So it would be Crohn's disease. Question number 5. Blank affects the inner layer of the intestinal lining. So blank affects the inner layer of the intestinal lining. It says ulcerative colitis affects the inner layer of the intestinal lining. Question number 6. Which bowel disease starts in the rectum and migrates in a continuous fashion throughout the colon? So this one starts in the rectum. It is ulcerative colitis. So the more severe the disease, the more the disease will migrate throughout the large intestine until it affects it all. Question number 7. Which of the following is not a potential complication associated with ulcerative colitis? So which of the following is not a potential complication? So there's toxic megacolon, B. anemia, C. stricture, or D. peritonitis? So the complications of ulcerative colitis is toxic megacolon, anemia, and peritonitis caused from rupture of the bowel. Anemia is from bleeding ulcers. Question number 8. A patient has the following symptoms: urgent and frequent bowel movements of diarrhea that contains blood with pus and mucus, low hemoglobin/hematocrit, potassium level of 2.0. Based on the patient's signs and symptoms, which disease does this describe? Urgent and frequent bowel movements of diarrhea and contains blood with pus, mucus, low hemoglobin, and hematocrit. Potassium level of 2.0. So ulcerative colitis is the large colon, or the large intestine. So symptoms for ulcerative colitis mnemonic is ulcers. So urgent/frequent need to have bowel movements, electrolyte imbalances, elevated temperature, severe diarrhea with pus, blood, and mucus. So it would be ulcerative colitis. Question number 9. A patient had a colonoscopy which showed a cobblestone appearance of the GI lining. This is found in Crohn's disease. So Crohn's disease will give it a cobblestone appearance when the patient is scoped. Question number 10. A patient with severe ulcerative colitis had a barium enema. Which finding is associated with this disease? A. Cobblestone appearance of the colon. B. Colon sign. C. lead-pipe sign. Or D. McBurney's sign. So, for ulcerative colitis, loss of form 2, haustra of the large intestine, which will display as a lead pipe dash sign on barium enema. So it'd be C. Question number 11. Which type of bowel disease is most likely to cause severe malnourishment? So malnourishment usually occurs due to the body not absorbing the nutrition, and that is usually occurring in the small intestine. And small intestine is usually affected by Crohn's disease. So we'll double check that. So the complications of Crohn's disease is malnourishment. It would be Crohn's disease. Question number 12. Select all the complications associated with Crohn's disease. A. Loss of form to the haustra. B. Fistulas. C. Strictures. D. Hemorrhoids. Or E. Anal fissures. So for Crohn's disease, there are anal fissures, fistulas, strictures, so it would be B, C, and E. Fistulas, strictures, and anal fissure. Question number 13. A patient has the following signs and symptoms. Abdominal cramping, which is mainly located in the right lower side. Ulcers in the mouth. Bleeding anal fissure, and diarrhea. Based on the patient's signs and symptoms, which disease does this describe? So ulcers in the mouth, that is the entire GI tract. So it was likely Crohn's disease. So abdominal cramping to the right lower side is associated with Crohn's disease. Okay, so now I'm going to submit my answers and see what I get. Okay, so here are your results. Your grade is A. Percentage of what you got right is 92. So let's see what I got wrong. Okay, it is question number 7. Which of the following is not a potential complication associated with ulcerative colitis where it affects the large intestine? So the answer is C. Strictures are a common complication found in Crohn's disease, not ulcerative colitis. So I had selected A, B, and D. So I was selecting the ones that are complications associated with ulcerative colitis and not the complication not associated. So which of the following is not a potential complication? So I read the question wrong, or I wasn't mindful enough when answering the question. So the correct answer is C. Strictures are a common complication found in the Crohn's disease, not ulcerative colitis. I hope this information was helpful. Please feel free to share this video with others if it's helpful. And thank you for listening. I hope this was engaging. And please feel free to subscribe and click the like button and go to registerednursern.com for more information and check out their YouTube channel. Thank you again for listening, and I hope you have a great day.